Hey guys, welcome back to the channel. Today we're talking about something that affects almost every single dog out there, and yet most pet parents don't even realize it's happening until it's a real problem: dental disease. Now, I see this every single day in the clinic. A dog comes in for something completely unrelated, maybe a skin issue, maybe a vaccination, and I open up their mouth to do a routine check, and there it is. Tartar buildup, red inflamed gums, sometimes even a tooth that's basically hanging on by a thread. And the owner has no idea because dogs are incredibly good at hiding pain. It's actually a survival instinct left over from their wild ancestors. Showing weakness makes you vulnerable, so dogs will keep eating, keep wagging their tail, keep acting completely normal even when their mouth is causing them serious discomfort. So let's break this down properly. What actually is dental disease? Why does it happen? What does it look like? And most importantly, what can you do about it? Dental disease, or periodontal disease as we call it clinically, starts with something you've probably heard of: plaque. Plaque is this soft, sticky film of bacteria that forms on the teeth pretty much constantly. It's happening in your dog's mouth right now, just like it happens in yours. The difference is you're brushing your teeth twice a day, and most dogs are not. If plaque isn't removed within about 24 to 72 hours, it starts to harden. It mineralizes using the calcium in saliva and turns into tartar or calculus, that hard, yellowish-brown, crusty stuff you see on the teeth, especially near the gum line. Now, tartar itself is a problem, but the real damage happens underneath it. Tartar creates this rough surface that traps even more bacteria, and that bacteria works its way down under the gum line. Your dog's immune system sees this bacteria as an invader and mounts an inflammatory response. That inflammation is what we call gingivitis. You'll see the gums looking red, maybe a little swollen, and they might bleed if you touch them or if your dog is chewing on something hard. Here's the thing: gingivitis is actually reversible. If you catch it at this stage with a good cleaning and better home care, you can turn it around completely. But if it's left untreated, and honestly, in most cases, it is because owners just don't know to look for it, it progresses to periodontitis. This is where things get serious. The infection starts breaking down the structures that actually hold the tooth in place, the periodontal ligament, and eventually the bone itself. This is irreversible. Once that bone is gone, it's gone. And this is exactly how dogs end up with loose teeth, teeth that need to be extracted, and in some pretty severe cases, jaw fractures because the bone has become so weakened. I want you to really picture what's happening here because I think it helps to understand why this matters so much. Imagine having a constant low-grade infection in your mouth every single day for years. That's essentially what's happening with untreated dental disease. And it's not just about the mouth either. Those bacteria don't just stay contained in the oral cavity. Every time your dog chews, every time they swallow, bacteria can enter the bloodstream. Over time, this has been linked to problems in other organs, the heart, particularly the heart valves, the kidneys, and the liver. So dental disease isn't just a cosmetic issue or a bad breath issue, it's a whole body health issue. Speaking of bad breath, let's talk about that because it's actually one of the biggest tells that something's wrong. A lot of owners think doggy breath is just a normal thing dogs have. It is not. Healthy dog breath shouldn't knock you over when they yawn near your face. If your dog's breath has gotten noticeably worse, that's usually bacteria's work, and it's often one of the very first signs of dental disease. So what else should you be watching for? Let's go through the signs because catching this early makes such a huge difference. Bad breath, like I just mentioned, is often the first clue. Next, take a look at the gums. Healthy gums should be a nice pink color, firm, not swollen. If you're seeing redness, especially right along the edge where the tooth meets the gum, or if the gums look puffy or swollen, that's inflammation. Sometimes you'll notice bleeding, maybe on their toys, or if you happen to touch their gums. Tartar buildup is another obvious one, that brownish, crusty stuff on the teeth. Usually worse on the back teeth and the upper canines. Some dogs get it worse than others. Genetics plays a role, breed plays a role. Small breed dogs especially tend to have more crowded teeth and are much more prone to severe dental disease. Diet plays a role too. Then there's behavior changes. This is the one that really gets me, because owners often miss it or misattribute it to something else. Dogs with painful teeth might start chewing on one side of their mouth, or they might drop food while eating, or become hesitant around hard kibble or chew toys they used to love. Some dogs will actually stop wanting to be petted around the face or head because it's uncomfortable. Some become a little more irritable in general, not because their personality changed, but because they're in pain and nobody's addressed it. You might also see excessive drooling, sometimes with blood in it, pawing at the face or mouth, reluctance to eat or eating much more slowly than usual, or preferring soft food over their usual kibble. In more advanced cases, you might actually see a loose tooth or a tooth that's discolored or swelling on the face, particularly under the eye, which can indicate an abscessed tooth root. Now let's talk about why some dogs get this so much worse than others. Small and toy breeds, think Yorkies, Chihuahuas, Pomeranians, Dachshunds. These guys are notorious for dental disease. Their teeth are basically the same size as a larger dog's teeth, crammed into a much smaller jaw. That crowding creates more places for plaque and tartar to accumulate, and it makes the whole periodontal structure more fragile. Age is another factor. Obviously, the longer plaque and tartar have been accumulating, the worse the damage. By the time a lot of dogs hit 3 years old, they already have some degree of periodontal disease, and that number just climbs as they get older. Diet matters too. Dogs on purely soft or wet food diets tend to accumulate plaque faster because there's less mechanical abrasion happening as they chew compared to dry kibble or dental chews, which can help scrape some of that film off. And of course, individual variation, just like people. Some dogs seem to have naturally more resilient gums and teeth, and others seem to get tartar buildup almost no matter what you do. Okay, so now for the part you're probably really here for. What do you actually do about all this? First and most important, regular veterinary dental checks. This should honestly be part of your dog's routine wellness visit. And if it's not being checked, ask your vet to look. We're trained to spot the early signs before they become big problems. And if we see something concerning, we can recommend a professional dental cleaning. Now let's talk about professional cleanings because I know this is something a lot of owners are hesitant about, mostly because it requires general anesthesia. I completely understand that concern, and it's a valid thing to think about. But here's why we do it under anesthesia. We need your dog to be completely still and pain-free so we can properly clean not just the visible part of the tooth, but under the gum line where the real disease is happening. We also take dental x-rays in a lot of cases because a huge amount of the pathology is happening below the gum line, roots, bone loss, stuff you simply cannot see or assess with your dog awake and moving around. Trying to do a proper cleaning without anesthesia is honestly more stressful for the dog, and it misses the areas that matter most. Modern anesthesia protocols are very safe, and we do pre-anesthetic blood work and monitoring throughout the procedure specifically to minimize risk. During a dental cleaning, we'll do a full scale and polish similar to what you'd get at a human dentist. We'll probe around each tooth to check for pockets which indicate bone loss. We'll take x-rays to assess the roots and bone, and if we find teeth that are too damaged to save, we'll extract them. I know that sounds scary, but honestly, dogs do remarkably well after extractions. Once that chronic pain source is gone, owners very often tell me their dog seems years younger, more playful, eating better, just generally happier. It always amazes me how much dogs were quietly tolerating before we intervened. Now, prevention. This is really where the power is, because if you can stay ahead of this, you can avoid a lot of pain for your dog and a lot of cost for you down the line. Toothbrushing is genuinely the gold standard. I know, it sounds like a hassle, and yes, some dogs are going to fight you on it at first, but if you introduce it gradually with positive reinforcement, a lot of dogs actually learn to tolerate it. Some even enjoy it. Use a dog-specific toothpaste, never human toothpaste, because ingredients like xylitol are toxic to dogs. Ideally, you're aiming for daily brushing, but even a few times a week makes a meaningful difference compared to none at all. If brushing just isn't happening, there are other tools. Dental chews and treats that are designed to mechanically reduce plaque and tartar. Look for ones with the Veterinary Oral Health Council seal. That's a good indicator they've actually been tested and shown to be effective, not just marketing. Dental diets, which are kibble formulated with a specific texture and shape to scrape the teeth as your dog chews. Water additives and dental gels, which can help reduce bacteria in the mouth. And of course, regular professional cleanings on whatever schedule your vet recommends based on your individual dog's needs. I also want to mention avoid giving your dog things that are too hard, like real bones, antlers, or hard nylon toys. I know a lot of owners think these are great for cleaning teeth, and to some degree, they can help with plaque, but they're actually one of the most common causes of fractured teeth that I see in the clinic. If you press your thumbnail into a chew and it doesn't leave an indentation, it's probably too hard and could crack a tooth. Let's talk a little bit about what happens if dental disease is left completely untreated for a long time, because I think it really drives home why this matters. You can end up with severe periodontal disease leading to multiple tooth loss. You can get oral fistulas, which is where the infection actually erodes through the bone between the mouth and the nasal cavity, causing chronic sneezing and nasal discharge. You can get jaw fractures in small breed dogs because the bone has become so weakened by chronic infection that it literally breaks sometimes just from normal chewing. And as I mentioned earlier, systemic effects on the heart, kidneys, and liver from chronic bacterial exposure through the bloodstream. None of this is meant to scare you, I promise. I'm telling you this because it's so preventable, and it's one of those areas in veterinary medicine where a little bit of proactive care goes an incredibly long way. So here's what I want you to take away from this. Look in your dog's mouth regularly, get comfortable lifting the lip and having a peek at the gums and teeth. Smell their breath and actually pay attention if it changes. Bring up any concerns at your regular vet visits, even if it seems minor. And don't be afraid of professional dental cleanings when they're recommended. They really are one of the most impactful things you can do for your dog's long-term health and comfort. Your dog can't tell you their tooth hurts. They can't point to where it's sore. It's on us as their caregivers to watch for the subtle signs and step in before it becomes a much bigger, much more painful problem. If you found this helpful, let me know in the comments. I'd love to hear about your own dog's dental care routine, and if you've got any questions about something specific you're seeing in your dog's mouth, drop it below, and I'll do my best to help. Thanks so much for watching, and I'll see you in the next one.